So let me start so that and these are kind of confessions of a born-again aficionado of, perfect, good, of concerns of women for heart disease. So I was late coming to the party. In terms of disclosures, I have nothing except to say that I was wrong for many years. I guess I tell that to women a lot, but makes me special but not unique as a guy. So this is where I started. One can reason, and what I'm going to tell you is that there's an epidemic of heart disease in women that we're absolutely not appreciating. On the other hand, there are probably some segments of the female population that you're overtreating for cardiovascular risk factors. So I would suggest that in terms of primary prevention in heart disease, women are probably the most underserved population that we have. So let me start from the beginning. Where was I only a couple of years ago? One could reasonably think, why worry about women and heart disease? After all, men died sooner. Women less likely to die of heart disease. They died of other things. Less likely to have hypertension. So yeah, what's the big deal? We should be worrying about guys because we're dying more. Turns out I wasn't the only one who thought that way. Does anybody remember Virginia Slims? Did anybody smoke Virginia Slims? Don't answer that question. Their whole basis of selling that drug was trying to level the playing field, that is, bring women down to the same higher biological risk as men. So they started it that way. I mean, I picked turns out if you look at those ads, they were mainstream and showing up in women's magazines. Most of them are kind of offensive. This was probably the least offensive that I could find, kind of a Wonder Woman because they're biologically superior to men. But it was kind of stating it as it was, believe that they're biologically superior, so please smoke Virginia Slims so you can bring your risk up to a man's level. So, okay. Turns out they were wrong too, although they sold a lot of cigarettes. But here's the reality. Women with heart disease have a problem, or heart disease in women is a bad combination. Why? Women with heart disease are less likely to be diagnosed, less likely to be treated appropriately. After menopause, more likely than men to have cardiovascular risk factors adjusted for age, less likely to be treated appropriately for their risk factors, either, and I'm going to show you, mostly undertreated, but occasionally overtreated. So in the context of, thank you Virginia Slims, I don't think it's still around, but in terms of management of heart disease in women, I don't think we've come such a long way. Let's start with dispelling myth number one. That is, heart disease in women it's an equal opportunity, gender neutral disease. Women are as likely to die of heart disease as men. It was true in 1994, it's true in 2004. So women are a little more likely to die of heart disease than men. You have to die of something. But heart disease, women are pretty good overlap in terms of the Venn diagram. So that's the starters. But secondly, women who have heart disease have a problem, have a greater problem in the system and with management than men. For example, if you're a woman, you show up with heart disease or have an MI, you are 50% more likely to die in the first 30 days after your MI. So whether or not it's at ages, 20 to 75 plus, overall, more than 50% higher in-hospital mortality following an MI. So you have it, you're likely to die of it, but actually, if you actually have the disease, in the first 30 days, you're more likely to die of it. So similarly, even if you get fixed, you're more likely to have problems. So women's complications of revascularization rates, these days primarily post-angioplasty, about 50% higher in women than men, kind of across the board. Maybe a little better this is mostly data prior to drug-eluting stents. Post-drug-eluting stents, maybe the data is a little bit better, still lagging behind. Even if they get out of hospital, women are less likely to be treated effectively. Now, this is an issue in terms of not diagnosis or management. This is saying these are people who've already had established coronary artery disease, and as compared to men, women are less likely to be treated, and the men in blue, women in whatever color that is, less likely to be treated with aspirin, less likely to be treated with a beta blocker post-MI, much less likely to be treated with a statin, and much less likely in terms of combination, and much less likely to be at targets either for blood pressure or cholesterol. So even given the same extent of disease, women do worse in terms of treatment. So in terms of following from the lunch, this is so if kind of globally we have a therapeutic inertia problem, it's doubled in females. This is probably best, let me give you a couple examples, and the rest of the time I'm going to take is go through a couple cases to try to demonstrate that and how it impacts in practice. So here is Pam. So 52-year-old, postmenopausal female, runs 5 days a week, maybe smokes a little, but she's fine. She's just in for her regular physical, has some history of bad circulation in her family, but not bad. There she is on examination, doesn't look bad, blood pressure up, just a titch, I guess. And let's pretend that's not white coat hypertension, but nothing else I could find on exam. Here are numbers. Her numbers look pretty relatively benign, maybe a little bit off, but cholesterol is close to 5, LDL 3.3, HDL down a titch, triglycerides fine, blood sugar fine, glycated hemoglobin fine. So that's a typical postmenopausal female that you're going to see. Okay, so let's do this in terms of just getting some idea where we are on this lady. As we step in terms of management, remember we're talking about over-treatment, under-treatment. So in terms of those of you who don't carry your Framingham calculators, how many think Pam's 10-year risk is kind of on, let's do it from, how many think it's moderate? I mean, it's like, by moderate, I mean guy, globally, compared to a 52-year-old guy. So if we say that the average 52-year-old guy risk profile is about 11-12%, how many people think that she'd be moderate? How many people think she's low? How many people think she's high? Perfect, yes. So the answer is, it's high. And you didn't figure it out. Now, I did a couple tricks that Guy showed you in terms of jimmying with some of the risk profiles using Framingham versus SCORE, which he probably would have talked to you about. But on the other end, so forgive me for that, Guy, but close enough. So this is a lady who walks in the door